I'd like to call the meeting to order. I'd like to invite everyone to stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to begin with a moment of silence, please. Begin our roll call. Start with Commissioner Culberson.
Here.
Commissioner Smith is present. Commissioner Shimke.
Here.
Commissioner Stevens by phone.
Here.
Commissioner Cause by phone.
Commissioner Cause is here.
All right. All commissioners are here in some form. I'd like to open up the public comment portion of our meeting. I'd like to ask the individuals that are calling in to please state your name.
Mr. Rivera?
Yes, ma'am.
Okay, you are ready to go for your public comment.
Okay, thank you. Good afternoon, commissioners. My name is Carlos Rivera, and I am the owner of Straight S Barbershop in Leavenworth, Kansas. I'd like to open a discussion about the reopening of our industry in our local area as part of the governor's phase 2. The impact that COVID-19 has had on our small businesses is tremendous. The amount of financial hardship is unreal. Most shop and salon owners have gone from a very productive living to zero income. We have all been aware of all the programs in place through the Small Business Administration, but many shop owners and operators do not qualify or have received limited or isolated relief through this avenue. I am happy to share that I have received some funding through a company through AltCap to have my business expenses taken care of for approximately 30 days. That was about 25 days ago. We have been closed since March 18th of 2020, approximately 43 days in counting. We are expected through the governor's orders to be closed until no earlier than May 18th, which would be 60 days in the best case scenario. After reviewing your proposed guidelines based on the draft shared with the community via Facebook, I feel that they are closely aligned with our normal business practices due to the industry training of disinfection and sanitation to acquire and maintain our licensing. The professionals in our area are among the leaders in this industry, and after speaking with many of the industry professionals in our town, barbershop and salon owners are going above and beyond to keep our businesses and most importantly our clients safe. I am confident that salons and barbershops are able to help to do their part in taking care of each other while conducting regular business under the proposed parameters because of our intense training and education in the state sanitation rules and guidelines. I would like to share what our barbershop will be doing, and it is shared by many of my fellow industry leaders. We will maintain our appointment only, which allows us to maintain a list of clients serviced to help better in-contact tracing. Shop owners, we will limit the number of patrons to the shop to one patron per barber. Barber chairs are to be set at least 6 feet apart. Patrons must wash their hands or sanitize upon entering the barbershop. Shop owners will enforce the one patron out, one patron in rule based on the barber chair's vacancy. Barber capes will be changed and disinfected in between servicing clients, and barbershops will wear proper protective equipment at all times while servicing patrons. And all barbers will continue to comply with the appropriate disinfection rules set forth. So I ask that you guys consider this in your county plan, and we look forward to seeing what that plan is and getting ourselves back to work. Thank you.
Okay, thank you, Mr. Rivera. Next call in, please.
Mr. Greer?
Yes.
Hi, you are now able to do your public comment. You have 3 minutes if you want to go ahead.
Okay, thank you. Hello, my name is Daniel Greer. I'm the president of Marble White Uniforms in Leavenworth. Our company supplies uniforms to U.S. military and first responder organizations all over the nation. We have over 50 employees that work at our headquarters in Leavenworth. I wanted to call in and place my support for carefully aligning Leavenworth County's response with the state of Kansas' reopening plan. As we have seen, there's much conflicting information on how to respond to this disease, so any opportunity to have a unified voice is very helpful. The policy that is different from the rest of the state adds confusion and tempts residents to travel to other counties to see goods and services in less restrictive environments. I think we'd all let our fellow citizens stay put in Leavenworth County as much as possible. Leavenworth County is a mix of suburban and rural communities. We are not a densely populated urban community like Kansas City. We should therefore align a recovery plan with the greater state of Kansas versus the metro area of Kansas City. I think the council is wise to move today after the governor has released her plan. So I think that was a good move. So I just wanted to speak on behalf of that. One other concern I have is it looks like there's some requirements for tracking of customers. And while I understand that, the question I have is who will be able to have access to that information and how will that be safeguarded? I know haven't established policies for all that yet, but that's, I think, as many businesses, the privacy and security of our customer information, especially as we deal with the military, is very important to us. So we just want to address that, and also just the concern of keeping track of religious services. I think that's, can be a very slippery slope. So just wanted to know how that will be safeguarded, how that information will be accessed, who will have access to that information, just make sure that there are good safeguards in place for all that type of thing. So appreciate the work of the county and all the things they're doing to keep us safe. I think this is, we're heading in a good direction, so thank you so much.
Thank you, Mr. Greer.
Thank you all.
Mr. Gerstenberg?
Yes.
Hi. You are now able to do your public comment. You have 3 minutes if you want to go ahead.
Thank you very much.
You're welcome.
My name is Brett Grossenberg. I'm the owner of Mr. Blee's Heating and Cooling. As a longtime resident and small business owner in Leavenworth County, I have seen firsthand the effects of this lockdown on our citizens and our economy. Several local restaurants and shops have closed with no ability to reopen. People's lives turned upside down and their lifelong dreams crushed. We were told the lockdown would expire on May 4th. However, for many businesses, the lockdown continues. For many residents, the things they want to do, they cannot. The young lady who cuts my hair cannot. And frankly, that is leaving me looking a little shaggy. Our right to choose has been taken away, through no fault of ours. And what about the mental health of our citizens? Is this isolationism likely to cause an upsurge in loneliness and depression for those more prone to these conditions? This virus is real. It is dangerous. However, it is primarily dangerous for the at-risk. But what are the dangers of this solution for everyone else? The free people of this county have lost essential liberty in a country founded on liberty and freedom. Thomas Jefferson said, "I prefer dangerous freedom over peaceful slavery." We should be given information and recommendations that ultimately allow the freedom of personal choice, not forced into compliance. Our freedom should be restored. Thank you for listening.
Thank you, Mr. Grossenberg.
How many requests do we have? I know, I was afraid there was far more.
Time to mute my phone, huh?
Ms. Meitler?
Yes.
Yes, you all have 3 minutes, so whenever you're ready for your public comment.
Thank you. Good afternoon. My name is Gretchen Meitler. I'm the owner and director of a child care facility in Tonganoxie, Kansas. As a business owner, myself and my team have had to overcome many of our ways that we do business in the last few weeks. Thankfully, we were deemed as essential, even though we have had to drastically reduce numbers in many of our classes, which has changed up scheduling and other things. Unfortunately, many of our parents who work for small businesses, our medical staff, dental offices, gyms and wellness centers, hair salons, like I've been mentioned, those who are non-essential were forced to hunker down and go without pay for many weeks until they received their unemployment. But because of their businesses not being eligible for assistance, because many small businesses aren't, they have suffered. Please note that while all this was going on, we shut down government offices, and to my knowledge, not one of those government employees were forced to go home and apply or try to maneuver the unemployment system to pay their bills. Many families, young and old alike, do not have emergency funds to sustain the way of life during an unprecedented time like this. Not only have we placed our state in a financial nightmare, we've also forced parents, some working, some not, to become full-time teachers for their children. As a mother of 2 children still attending grade school, I'm not impressed by the plans that were put into place to answer the decision of our governor to close schools for the remainder of the year and maybe longer. I believe citizens of the United States of America and Leavenworth County, Kansas should be able to make their own common sense decisions as to whether they think their business is essential or not. Receiving a paycheck is essential to survive, especially if you want to work and not live off of our already broke system. I also believe it is our right to attend religious services if we so choose. My questions remain. Why are certain elected officials attempting to control our God-given and constitutional rights? That is not why they were placed in office. They are not rulers or dictators. They are all elected officials supposedly representing us, the citizens and voters. Because of these bureaucratic and arbitrary actions, some of us will see more deaths because of lack of treatment to include mental health than what we would have just from this virus. Because they can't go and get that care. Better yet, what about the person with a weight or mental problem who can't be seen by a counselor or a coach? Not everyone has the internet ability to Zoom themselves silly like many of us have. Please let our country go back to the way, and our county, go back to the way it had been. Let our citizens show that we can do better, staying clean, healthy, and increasing our common sense factors so that we may continue to live the way we were and have been, while implementing some changes recommended if we so choose. Thank you for your time, everybody.
Thank you, Gretchen.
Thank you.
Okay. This concludes our public comment portion of our meeting. We'll move on to administrative business, which would be why we're here today.
Yeah, so administrative business, or really the only topic on the agenda today was discussion of the Leavenworth County's plan or order for reopening the county. Yesterday when we met, we discussed waiting until we heard from the governor to see what the plan was at the state level, and then allow us time to evaluate it. Mr. Miller, the County Councilor David Ann Paris, and myself have reviewed both the governor's orders and ours, and what we have determined is that for the most part, what the state plan is what we would follow, because it is likely more restrictive than what we were originally proposing to begin with. There are very few guidelines that we would like to go ahead and continue to implement, but I do not believe, and Jamie, you can help me on that, I don't believe there are actually any further restrictions in the order that we're proposing. I circulated it to you, and I realize you've only had a few minutes to review it, but we were working on it right up until we walked in here, just so we could make sure that there wasn't anything that would be contrary in ours to the state's. Some of the questions that came up today during public comment, such as the tracking of customers, we realize the challenges there. While that would be helpful in some instances, in other instances we realize it's nearly impossible. So if we can't enforce it equally, we've always kind of been our belief is if our policies aren't equally enforced, then they shouldn't be enforced at all. So we've removed that actually as a requirement or a recommendation in our order. So that
it's actually still in, but it's under should be kept, and I just want to briefly talk on that because again, that is part of the process for the health department to continue on cases and be able to identify and box in and things of that nature. When we are talking about customer logs or visitor logs and things of that nature, that is kept at the business. We don't want, you're not turning those in. That isn't anything. It is in case there's an actual case that presents and is affiliated with a business. We can go back quickly and identify those that we need to contact immediately. It's actually to the protection of the residents that are out there that may have gone to a business, a restaurant, so on and so forth, that we need to make contact after there is a contact or a known source at that establishment during a time frame. It will speed up the process of us being able to track down those individuals that may have contact and then need testing down the road. So as we're not necessarily making that a mandate or any of those type, it is highly encouraged for businesses that are going to start opening and trying to have individuals in. We understand big box stores and things. That's going to be very difficult. But maybe a small shop that is in Leavenworth could keep a log of who's been in their shop over the past 14 days in case there is an exposure into their shop or in. We then know who's there. We can make those contacts. We can get those individuals tested. We can help with that process, and the community and the business owners can help. That's why we're implementing those recommendations in with this order. It's not to make any strain. It's not to have anyone's personal information. It's information that if there is a case, that is part of the contact tracing to be able to go on to those next phases. And again, we want to open up the Leavenworth County. We want to open up the businesses. And again, if you read all the phasing, even from the governor's orders and such, we have to do testing, we have to do contact tracing, and we have to be able to keep on top of it. And if we get to a point where we can't, because again, cases are everywhere and we're trying to track people and so on and so forth, we're not going to be able to open up to those next levels. And that's going to be the problem that we're running into and why we're putting right now this in as a recommendation to businesses as we're getting ready to start opening, kind of that practice to help us out in the future.
Okay.
Jamie, this is Commissioner Stephen. I have a question for you.
Go ahead.
Just a clarification on that. Those logs are going to be strictly kept at the business. They would only be used by the government through the health department if you were doing contact tracing, and we will not be giving that information to any other government agency. It will not be disseminated. It will not be in any way put forward to any other government agency other than kept at the business, correct?
That is correct.
Thank you.
And I would just quickly add, I think it's a recommendation for obvious reasons, and if you went into somewhere that had exposure, would you want that phone call? So I think you have to ask yourself that. People cannot be made, and if a business owner doesn't enforce it, there's very little we can or should obviously do about that. I do think one of the callers on public comment made a great point about secure information, and the reality is if you don't have a way to securely intake personal information, you shouldn't. But I'm going to guess most any business that deals with transactions is already obtaining a lot of that information, whether it's via credit card or anything else. You'd like to think they have some procedures in place to protect personal data. But I thought that was a great point, and I thought all the callers, I just wanted to say, one, thank you for the public comment, and two, I think you've got unanimous support. And honestly, if the governor hadn't made the decision that she did last night, they would all be open on Monday in some fashion. So we feel you and are very disappointed. So
Yeah. Now on our website, are we going to be, what we passed today, or agreed to today. We'll have that posted with a contact number for anyone with questions. And do we have, I forwarded Mr. Lawfrey a deal for PPE I got today. Did you have a chance to look at that?
I have somebody checking to make sure that it's legitimate.
Well, that's what I don't, and that's why I was asking if them prices and
We receive probably, I don't know, 10 of those a day.
Okay.
And most of them are not anywhere near legitimate.
They'll take your order, but can't
The state of
supply
Kansas
it.
actually has a vetting process for
Okay.
all of those. So before any local you should really vet any PPE
Yeah.
manufacturer that's sending an email that they can get you masks or any of the PPE
Okay.
that needs to be out. And there's a vetting process through. If anyone has any questions, they need to contact. They can contact the JIC by email, but they can vet that through the state of Kansas as well,
Okay.
who is making sure that those are legitimate companies to
Okay.
actually sell appropriate PPE.
So is that list out there for like local businesses that want to purchase PPE?
I can look. I can, and if it is, we can put it out on our websites and everything else. If
I think
there's
that'd be
a contact,
helpful.
I'll look into that when I get back on if that's how that can be put out.
Okay.
One question I had was, before we get into anything specific we're doing in Leavenworth, is when a business owner has questions about the governor's orders, do we give them the governor's phone number? How exactly do you want to, how are we going to address that versus anything that Leavenworth County is doing? Leavenworth County should answer. Anything the state's doing, I feel the state should answer. So.
Commissioner Shimke, members of the commission, this is David Van Paris. That's an excellent point, Commissioner. I was able to briefly watch the governor's address last night. I was more interested in actually receiving the written order to see what's contained in it. Inasmuch as the language of the governor's order was prepared by the governor's office and the state, I would suggest we tread on pretty thin ice when we try to independently interpret the meaning of that. So not to pass the buck, but yes, I think we should refer specific questions to the governor's office. Certainly this office and county offices will endeavor to help citizens with regards to those questions, but the final interpretation is going to have to come through the office of the governor.
Yeah, I mean, some of the, I know we've all received emails and have been daily, and since last night, even more and more phone calls. And, one of the more obvious ones, and obviously what we have a lot of, is, restaurants and bars, and how do you delineate between them? Almost every restaurant has bars in them, and almost every bar serves food. So I don't know how one classifies themselves other than as an LLC.
There you go.
Well, Commissioner, I'd just share this. As an attorney by training, I can look at a document and come up with several interpretations depending upon the situation. And this executive order fits within that category as well. It's subject to interpretation and different viewpoints. And again, that's why I believe we can provide assistance, but the final determination of the intent behind this is going to have to come from the office of the governor. The plain language of the executive order, certainly we will endeavor to follow and interpret that. But our understanding of the plain language, unfortunately, under certain circumstances, may not be that which was intended by the office of the governor.
And I don't want to get too far ahead, but just so on that topic, what can we do at the county to open that dialogue and or challenge the state? If you have a business, I don't care what industry, if they can operate under these same guidelines, why should they not be allowed to? And what can the county do versus what the individual businesses could do relative to that question? So,
well, one of the callers earlier this afternoon did allude to the fact that we are under representative government. So the first step would be ask questions. If the answer is not one that you agree with, then certainly forward it through to the elected officials who are responsible for those orders, in this case largely the office of the governor. Of course, this office has responsibilities as well. So again, as far as final interpretation, I think it's going to have to come from the governor. We will assist. As far as any changes in the policies that are enumerated in the governor's executive order, they're going to have to come from the governor, but this body could certainly serve as a conduit to forward those on to the office of the governor as received by our constituents.
Okay.
This is Commissioner Stephen. I did have a question on a couple things for the county councilor.
I'm still here.
Okay. I had a constituent ask about what the penalty for violating would be.
Well, under the statute that the governor issues this executive order, and the specific powers are enumerated in KSA 48-925, and I'll read it to you. Under the provisions of this act and for the implementation thereof, the governor may issue orders and proclamations which shall have the force and effect of law during the period of a state disaster emergency declared. Force of law, it does not specify which area of misdemeanor offense violation of this would be, or whether it would largely fall under civil penalties. Given the nature of trying to deal with a disaster that has unknown parameters such as this, I believe most likely the enforcement would be through requests for cooperation. That's certainly going to be the most effective and the most the preferred route. The second would be if local law enforcement felt it was necessary, they could enforce that through the issuance of citations for a misdemeanor offense. I do not believe that our local law enforcement or even state law enforcement has any current intention to do so. So at this point in time, Commissioner, I think although a violation of the orders is technically a violation of Kansas law, that the primary enforcement is going to be through a request of cooperative effort.
Okay, the second question is in terms of the settlement between the district court judge and the churches in western Kansas and the governor's order. My reading of the order is that churches are deemed essential. Is that correct?
Commissioner Stephen, under Executive Order 2016, the governor does designate the exercise of religious freedoms as a necessary and essential function, and that's under Section 12 of the order. And that is 12B, perform or attend religious or faith-based services or activities. In short, yes, religious activities are considered to be an essential function.
Okay, restaurants, there seems to be some confusion under Phase 1 if the dining rooms are limited to 10 or if there's some other rule. Do you have an interpretation of that, or is that something we're going to have to get a ruling on?
Well, the number 10 is hard to argue with. It's an absolute figure. However, there's other reference to social separation, the use of guards, various cleaning. So without trying to kick it over, I'm going to defer to Mr. Miller's interpretation of that. But generally, the same restrictions that apply to all businesses would apply to restaurants.
So I would interpret that. Does that mean 10 we're telling people?
Excuse me, Commissioner. Mr. Loffer has pointed out to me, under the proposed order, under the effective order, it reads, this does not limit the total occupancy of a business, but requires the business limit mass gatherings in areas in instances where physical distancing cannot be maintained, such as tables or in entrances, lobbies, break rooms, etc., as long as a restaurant could maintain the social distancing that's suggested both by the executive order, the practices that have been outlined, as well as any industry standards. There's no specific limit. Although 10 is referenced in mass gatherings, it's a number that is more or less, in the event you cannot meet the other requirements, you're limited to 10. If you can meet those requirements, then that limitation of 10 no longer applies.
Okay. Also, I had a letter from somebody at the VFW, and they have a bar/restaurant serving food. Would they be interpreted? What would be the interpretation of whether it happens to be a bar or a restaurant? Would that be the serving of alcohol, or would it be the percentage, or how are we going to give people guidance on that?
Commissioner, actually, I think that email maybe came to the whole board, and I did reply to that individual that they would probably need to reach out to the governor's office or the KDHE to get an interpretation, because they could also fall under the leisure activities, which are completely prohibited. So I don't know that we can weigh in on that one.
Okay, and I just have one more. Would it be appropriate for the county commissioners, if they so chose, to send a letter to the governor regarding personal care workers and the restrictions on them at this time, being the fact that so many of our people are going to be going across the river to have haircuts and such in terms of the order? Is that something the commission, if it so chose, could send a letter and request her to review?
Commissioner Stephen, I earlier referenced this is representative government. The answer would be if this board chose to forward that request to the governor, certainly. And this body, governing body, does have, perhaps for better or worse, a better channel to the ear of the governor than an individual citizen might. So certainly you can act as a conduit for those types of requests.
Okay, thank you very much. That's all I have.
Anything else on this order that we need to go over?
Again, most of ours are just guidance. I don't know if Mr. Miller wanted to highlight anything. You know, the only restrictions come in term with like care facilities, so I think those are already in place. It's nothing new, but everything else is mainly just guidance as far as best practices.
Okay. And this is, so no confusion on the date, would be May 4th it would begin. Anybody have any questions on this order? I mean, when we call it a state of disaster emergency, I've just figured we would be getting all kinds of FEMA money for this.
And of that as well, Commissioners, our local emergency order is set to expire also here in the next few weeks, because we put a 60-day window on that when we first signed that in. That was from March 17th to for 60 days. So May
The 15th, I think.
Yeah, I believe it, by doing the dates out, I think it's May 15th. So, again, while we're still in this, we will also have to extend that order. So I will be producing that and coming back in front of the board at some point to extend our local order so we can stay under a local emergency order to be able to request supplies and things and apply for any sort of relief money.
Okay. All right. Anybody have any questions on this?
This is Commissioner Stevens. So, Jamie, you're saying the main, can you just walk me through exactly what the differences are between the governor and your order here? What is the exact departures?
Again, with not having Chuck McGaha from emergency management up here, a lot of those have to filter through emergency management as well. He was the one that produced the document for me on the last. It allows us, we have to be under a local order to participate into, it's kind of like the hierarchy, if you will, from my understanding, with the request of resources and the ability to receive resources, apply for things, or apply for any sort of grant dollars, funding, so on and so forth. So there's local declarations, goes to state declarations, goes to federal declarations. It also allows us to disbar certain mutual aid agreements, things of that nature across lines. It disbars using, it's just a process within any sort of emergency as this such, very similar to a flood or a tornado and things of that nature when we have to apply for FEMA dollars and things of that nature, and I'm sure David can weigh in.
So we have to have an order in place.
I'm really not looking at that. I think we're talking about two different things. I was looking at our county plan for reopening. What would you say is the difference, if you were summarizing, if you could summarize what the major differences are with the governor's order? Pretty much it's just giving more advice and more stuff.
Correct. Basically, looking at it, again, we took it as more of trying to give the advice and advisement and sharing the best practices for entities that want to open that may have been closed. We really haven't put any sort of additional restrictions in to any area, if you will, that's in this. We basically just called out some of the areas that we feel may needed more clarification or may needed more advice for best practices. And again, about the only thing we added in, again, was that contact tracing piece as a should and best practice for us to be able to, if needed, within a business, to have that contracting piece. And that is, again, under page 1 of the guiding principles be followed. And I'll read exactly as it says. A visitor or customer log should be kept to aid in contact tracing information to include date, name, and a phone number. That's the extent. And again, not kept by us, not going to be looked at, never going to, if it's never needed, it continues to stay at that business.
And voluntary is what you're saying.
It is voluntary. But what I am trying to express back out also, we are one of the few counties that are adopting just the governor's order. Every county probably around us is absolutely more stringent than ours. Clear to Douglas County, Johnson County, Wyandotte County, Topeka, Jeff County. There are multiple that are not even opening a restaurant yet. So we are trying to open up the economy. I am trying to be lenient with this. What I'm asking from a business owner that wants to open, help the health department. We are the ones right now receiving the 157 cases on a daily basis from prisons and different pop-ups and areas and such that we have to do all that contact tracing. We have been working nonstop doing contact tracing since this has started and cases have been coming in. And again, just that is a huge web, and that is a huge, huge undertaking, and that is not something to be taken lightly. I understand people want us to compare this to the flu and compare it to this and that and the other. But again, we're finding people are walking around with this asymptomatic and handing it off to people that are in that high-risk category, and that's the fear. As you start to release these guidelines, people are going to start to believe that it's safe. We can come out of the house, we can go places, there's no restrictions, there's less restrictions, and you put back into your head, I am safe. And that is not the case right now, as we are starting to do more testing, and we're testing on asymptomatics, as it should be looked at. When the prison did 240 plus case tests, is 75% of them had zero symptoms and all tested positive. That is a good sampling, and that should be something that comes to the forefront of everyone within our community to understand. That's huge. That means how many people out here right now are walking around that aren't wearing a mask, just walking around, have this virus, and can hand it off to someone else, touching things, breathing on things, so on and so forth. That is scary. Mm-hmm. That is very scary in the epi world and of this virus. Now, I understand it is everyone's position, but it's my position to make sure everyone is on the understanding what is out there, what the concerns are, what the best practices are. So that's why that piece was placed into our for the contact tracing, because when we are ramping up testing and we're doing more testing and people are going to come through, we're going to find out now that it's going to be open. People are going to be at a restaurant 2 days before they get tested. People are going to be at a retail shop 2 days before they're tested or results come back. And then we're going to have to trace back. And we're going to have to go through all of those. And it's going to be a lot easier for a business, for families, for everyone else to be notified very quickly than way behind and when the time it takes to try to track it all down.
Jamie, is there a threshold on the tracing? I mean, is at what point is it's a futile effort? I don't know what those numbers are. It's just my question to know that, one, we assume, based on what you just shared, there's lots of people walking around with it asymptomatic. We assume that, again, there's been lots of people that have probably had it and gotten over it, and they're not in any of these cases. So at what point is the tracing no longer, I mean, is there a certain volume? So as a Wyandotte or a Johnson County, are you reached a point where they're no longer tracing because the case count's so high? or Ford County?
We're still trying to, that's what testing is so important for, and that's why we're trying to increase testing, and that's where serology will come into play at some point, to be able to know how many were already affected and how many active cases are already out there. What we're concerned with right now are the affected cases that are out there, because those are the cases that are running around still spreading it. And basically that's that 1 to 3 rundown. So every person that has it that is shedding the virus that's walking around is going to be impacting at least 3 people. So start doing that web and look how far that can go out if that is not boxed in and contained and quarantined and gone through the process to where they're no longer shedding it. The point of contact tracing is to do that, identify all the cases that are positive, quarantine them down so they're not out in the public and shedding that. It's very difficult to do. For one, we haven't had the testing. So we are way behind the 8 ball in this. But what we do know about it is, again, the mortality rate seems to be very low in our community because obviously individuals have had this just based on the numbers that we've gone through about 45 days. Our numbers are not through the roof, but we weren't testing either. And that's also why I did a lot of probable cases in the very beginning to show how many people probably did meet the criteria for it, but I couldn't test them.
And how are we doing on test?
Tests?
Are we getting enough tests in
We
to
are
meet the
starting
need?
that process. We basically, anyone that calls in with a symptom absolutely gets a test. Anyone that's exposed to any sort of, that is a direct contact, gets a test. We are starting the process now of doing the asymptomatic testing. We've done the first responders. We're getting those results back. We're going to be doing essential workers in nursing homes. There's a lot of testing that it's coming down the road. In the last week, we've done probably about 200 tests out of the health department. And again, results on that are fairly low for test results, which is good. That's what we want to see. And again, we have just within about the week been able to start. Wednesday was the first time that we were able to test asymptomatic. So hopefully by the time I get back, I have all of the numbers of what that looks like.
Okay.
But
All right, just kind of clear it up. Restaurants can have 10, or they can have whatever amount that their establishment would allow social distancing in.
There are guidelines at the state level. As long as they follow those guidelines, those
Okay.
should be good.
This is Commissioner Stephen. On this Montgomery County plan for reopening, as far as the log, a visitor or customer log should be kept to aid in contact tracing. Information must include date, name, and phone number. When you're visiting with businesses about this, and I'm just wondering if we should even have a clause in here, but will we request the businesses to take affirmative action as far as protecting identity and privacy of the information? And is that something maybe we should put in that?
It's basically a shall or a
called-
should. It was a should do it. It doesn't say you have to do it.
Actually, there's a thing called the red flag rule that all businesses are required to protect personal identifiers for any customer. That's been in place for, I think, probably since 2001 or something like that. So this information would be covered under the same rules.
Commissioner Stephen, you do raise a good point. For example, if I were to walk into a local establishment that was keeping such a log and request it for my personal use, they would decline it. In fact, they'd be required to decline that. If the health department were to ask for it for the purpose of contact tracing, that's an entirely different matter. And the health department then would have the responsibility to maintain the confidentiality of that document other than for their limited use for contact tracing. This log is not something that's going to be posted online or published, or certainly it should not be. And again, it's voluntary, and the idea is to ask for assistance to the health department in trying to keep track of any positive cases.
I just want to, if we maybe added a couple lines of protection, maybe it'd make some businesses feel more comfortable, especially as people want to know that their names aren't going to be sold to telemarketing firms and such.
But Mike, I mean, I think it is important to remember that, again, I don't know what the percentage of transactions is, but there's very little cash used anymore, so 90% of transactions are by credit card. I'd much rather somebody have my name than my credit card number, meaning that's something they already have to protect. I mean, that's a business practice that's in place. And you talk about some of these other businesses that have been shut down that we would like to open, but the state will not allow. Use Mr. Revere that called in. If he's going to set an appointment with a person to get a haircut, what do you think happens when you set an appointment? It's a name and a phone number every time.
Yeah.
So asinine, in my opinion, that
Right.
he has to remain closed under the governor's order. But just keep that in mind for any of these, whether you're at the bank and you have to set an appointment or any other appointment anywhere else. Those are the two caveats that are required. It's a name and a phone number. So.
That's correct. So I don't think it's that big of a deal.
And if you don't want to do it, don't do it.
Yeah, right.
And if you want to stay home, stay home.
If
And if you should stay home, stay home.
If in doubt, don't go out.
Hey, there we go.
So, like I said, I would have liked to see, like I said, the salons opened anyways. I did have a question. Just had somebody run that by me. Agriculture auctions, there's stuff scheduled like at the Leavenworth County Fairgrounds. I believe there's an auction scheduled in sometime in May. How does that affect when it is a large gathering phase one?
Mr. Chairman.
Agriculture, I think, has got its own set of rules.
Agricultural is listed under the KEF Act as exempt. Mass gathering still has to be to the social distancing. Social distancing is still what has to, no matter what, even under KEF, you still have to do social distancing.
Okay.
It alleviates the number that can be within a mass gathering is what changes. So, again, when you start looking at that, it just spreads out the footprint, if you will, for what that gathering may look like. And again, we're going to be working with within the governor's order, but then there's certain gatherings that also, even with exempt, have some certain you can't have you still have to have the footprint, if you will, to maintain social distancing. If you can't, then even within her order, it says you cannot operate to that. So social distancing is the biggest. The 6 foot, think about the 6 foot radius around everyone.
Right. How many acres is it for?
Yeah.
Well, the other thing that's in here too is outdoor or indoor entertainment or large venues with a capacity of 2,000 or more. That's really the cap.
But that's not.
It wouldn't be.
Exactly.
It wouldn't be on the auction, but fairgrounds or fairs and all those things are already canceled too. So I think they just have to look at the governor's orders, and it's pretty. I think you can find an area in there, and if you can't, I encourage that they ask the governor's office for clearance.
Okay. But it seems like we get asked the question, so.
I'm curious about the KEFF, though, because it would almost seem like, take salons. If salons were to somehow create an association, and that association was then to apply with the KEFF, because there's obviously lots of protection for these businesses that were even obviously operating during
Prior
the total closure. So,
yeah.
I didn't create the KEF.
yeah, no, I understand.
I don't have a comment.
I'm just trying to answer business owners and give them recommendations,
Yeah.
because it's very challenging. I do think, and Mike brought this up, that while I'm not confident it would be seen or even responded to before we potentially get to phase 2, but something to the governor's office, in that we believe that there are industries that they have closed, that those industries have good guidelines, and we believe follow the recommendations that the governor has placed in her order, and we'd like to see those businesses open up under those guidelines. But
I think it'd be nice if they would just allow, like they said they were going to originally, the local governing bodies control their areas, so that we in the Leavenworth County have the ability to control Leavenworth County, because it seems like we would have a better feel for what needs to happen in our county than the governor would.
Well, I think it's worth stating in the executive order that the spread among 80 counties is an interesting way to word it, because if you also look at it, I believe there's only 9 that have 50 or more cases. So to keep that in, when you talk about local, only 9 have more than 50.
So you think we feel bad? What do you think them counties feel like?
That's right. So
When they kept businesses closed.
that's 96 of the 105 that have 50 or less. That's wow.
This is Commissioner Stephen. I do have another question for Jamie. On dog groomers, where do they fit into this? It's hard for me to interpret it.
Under the, that falls under the subsection of the Governor's 5-C subsection 5. That's a personal service or close contact.
So we're going to have the dog groomers be closed.
Again, I think they need to verify that through the state, because previously they were able to be exempted under one of the other exemptions, but I think they have to clarify that through the state.
Came back under KEFF came out and said dog groomers were not, because it went to veterinary services, but the veterinary services could be open, the dog grooming side could not. But again, as Mark alluded to, very specific, that would be something that, again, that business entity would need to reach out, and we would have to figure out if they're an exempt or does it fit under personal services.
My recommendation to business owners would be the more you ask, the less you're going to like the answer. So I would recommend following the guidelines of the general business and conduct business, but that's just me.
Well, this is why this is so problematic, is we're having to pick the winners and pick the losers, and I will be so thankful when this virus leaves us.
But to be clear, Mike, we're not. The governor did.
Well, yeah, I don't like being in this position, put it that way.
And for the commission, that is one reason why, again, myself as a health, obviously mine is the virus is my concern. That is what I'm after. It's the health, and again, I'm also concerned with the economic side of what this has done to our community, but also then why on the reopening we're deciding to work with the community in hopes that the community also works back with us, that we're not, all we are doing is following basically, and we have not put any more stringent guidelines as other areas and others have throughout the state have been doing into their areas, because again, up till coming into this at 1 o'clock, there's a lot of health officer talk going on behind the scenes on what orders are coming out for other areas, and I'm going to tell you, there's a whole lot of extension of orders, a lot of restaurants not even opening up to dining, things of that nature that, again, I've heard it on it, where we are up against the two counties that are of the highest counts of COVID-19 in the state of Kansas. That's Wyandotte County and Johnson County. And both of those together have over 1,000 cases amongst them, which are not just incarceration cases, which I keep hearing for our county by our numbers. But a lot of us travel to the Kansas City metropolitan. We work there, things of that nature. And again, we have a high exposure rate for Leavenworth County citizens outside of just here locally in Leavenworth County. So I have been monitoring those numbers in the Kansas City Metro. That's why I produced those numbers also for the board yesterday. So we understand, Kansas City Metro has more deaths than the entire state of Kansas, just in the Kansas City Metro. And the highest two are the two counties we butt up against. So again, in both of those, both extended their stay-at-home orders until May 10th. So again, we're trying to work with our community. I'm trying to give the community open back up. But again, we need the community's assistance to follow the guidelines, follow what this is, so we can continue to open back up and not have to go backwards because our caseload all of a sudden goes through the roof. And we do have a caseload that we can't control anymore here in Leavenworth County.
And Jamie, I think there's a lot of people that are confused. They think the county has more control or more say in this, and we don't. The reality is, if you'd like to be more restrictive than state orders, you can. You cannot be less restrictive, which is the challenge that we have. So those adjacent counties that you mentioned are more restrictive even than what the state has allowed, and it was our intent and has been to be less restrictive than what the state just announced. And unfortunately, there's nothing we can do about it.
So the more people wear their personal protective equipment, avoid large gatherings. If you don't feel safe, don't do it. Don't go out if you don't feel safe or if you're at high risk. We can hopefully get to the next phase and without any problems, without any surprises from the governor on any switching gears on this, and we can get through this.
Jimmy, have we had any, what has the communication looked like with the correctional facility? So there was obviously a lot of testing that was just conducted. I'm assuming that doesn't run through us. You report those numbers, but ultimately it's the state. It's the state's test. I do find it a little
Ironic.
well. It's the timing's kind of interesting that all that happened right around the same time as the governor's announcement. My challenge is that, or my concern is that we're giving inmates tests before other people potentially. I mean, we talk about test shortages. I mean, maybe that means I'm insensitive, but I'd like to make sure that we have people in our nursing homes and those that are at risk that are getting the tests that they need before maybe an inmate, but that's just me.
Employees.
Well, again,
But that's all ran by the state, has nothing to do with your department, right?
it's a process, and again, they have rights as well.
Sure.
You know, we can't, and I can assure you and the community that the testing wasn't put into play within, that was already something that throughout the week they were ramping up to getting testing to do that entire, because they were having issues again with a continuation of cases that kept it being exposed, so they made the determination to test an entire wing or area of the prison, and it was very similar to what we did of a sampling of first responders. It was this whole area is going to be tested, and they did 230 plus tests. And again, they were symptomatic and asymptomatics in there as well. And it just so happened that it surprised a lot of us when the results came out that almost 75% came back and still shedding that virus, and that they were testing positive. So that's where that 157 came. I believe before I left, I think another 10 coming. So there's going to be somewhere in the neighborhood of about 167 inmates or more that test positive just within the last 48 hours.
Right, I think it's upwards of over 2/3 of our number.
Correct, and that is something else that, again, we're putting out those daily numbers. There's been a lot of people confused. The state puts out, if I can real quick, the state puts out their numbers. They pull those numbers in the morning, and by noon they're releasing their numbers. It's the same. I try to pull my numbers by 3 o'clock, and that's all the new test results that get dumped in from hospitals, private labs, all that to get the most up to date. So what was in the morning was from kind of overnight from the state, and that's why our numbers at times are higher or they're different. It's because of just the times of when you're pulling those numbers out of the system. What ends up happening is the state then reports on our numbers the very next day. It's just we're pulling them in the afternoon and trying to put out the most accurate numbers by kind of the end of day of what we've dealt with all day. And that's what happened yesterday. The state dropped those numbers at noon. Everyone thought that we were still at 197 and that we weren't reporting numbers. We just didn't put our numbers out until 4 o'clock that afternoon from the state's numbers as well. So we are looking at readdressing, because of that large increase, just from, I'm going to look at pulling all of Lansing Correctional and put it in its own kind of grid and its own of tracking that. One is very important because, again, the state, they don't look at it as, well, Lansing Correctional and Leavenworth. It's, if you look at our numbers on the state and click on it, it says 300 and whatever we are, 57 or whatnot. I'm going to break that out, though, on our daily numbers and put that into a better grid. If I have time by 4 o'clock, it may not come out today, obviously, because I've been up here. It's a lengthy process. It's a manual process. It's not something that automatically we get those all on a spreadsheet, and it has to be divided out. So,
Okay. So, is there any reason that we would have to do a motion to accept the governor's order because we don't have a choice?
Right.
we do not want to add anything to it. Do the commissioners agree with that? Not to add anything to the governor's order?
The only thing, there's nothing for the board to approve. The governor's order is already out, and then our order will come through the health officer. And again, there's very little other than just guidance in there. So.
Okay. And then to avoid any confusion, the declaration that Mr. Miller was talking about was just a local disaster declaration that needs to be in place for funding and extra resources if needed.
Correct.
It has nothing to do with any rules or restrictions on businesses. Okay.
Okay, this is Commissioner Cox. I've remained silent, and so now I have a couple of things before we end.
Okay.
Okay, first of all, for Jamie and for Mark, for David Van Paris kind of putting together, I would like to see for the county put together some public service announcements that would include maybe questions that individuals, as they get ready to head out, could ask themselves as to whether or not they really need to be out in public at this time and, you know, going into businesses and increasing their exposure, just some questions that they need to ask themselves. I think Jamie kind of alluded to some of the risks, and I think that we should share those things in a platform and in a manner that would get that information out there for people to consider. So that's the one thing that I would like to see happen if that's at all possible.
Okay.
That's just something that I have kind of been rolling around in my brain.
Okay.
And then the other thing is that before we enter into this new phase, I want to thank our first responders and our medical professionals for putting their health and welfare at risk in service to our community. And then I also want to thank all of the essential workers who have and will continue to place themselves at higher risk of exposure while providing essential services to our community. And then finally, I want to thank Jamie, our health department, and our emergency preparedness team members for keeping all of us informed and for making recommendations to keep us safe as possible during the COVID-19 pandemic.
I agree. And I'd like to thank all the commissioners and the staff who worked so hard on the county's reopening plan that we didn't get to use. But the next time it should go a lot easier.
Next time.
Let's hope so. Does anybody have anything else before we adjourn?
Commissioner Stevens, yeah, I would like to offer a motion that we put this letter forth, and I'll just throw the motion out there for discussion. I'd like to make a motion that we have a letter drafted to be brought to us at the next Board of County Commissioners meeting, urging the governor to review and urging her to include personal service industries such as hairdressers, dog groomers, and gyms be included in phase 1, reviewing whether these companies and organizations are observing social distance and PPE requirements and all professional requirements. And we would present that letter to the governor, and perhaps she could modify her order. We're going to have a lot of our businesses over here on this side of the river closed, and people are going to be traveling to the other side of the river. It seems that, and on the 8th, this is going to extend to the 18th at least. Seems like we should ask for a review at least.
Are we still in the same motion? I don't think you completed your motion, Commissioner. You started on to some other discussion.
No, well, I just put that motion out there. You want me to read it again?
Mike, I just had a thought, if it's all right. My recommendation might be, rather than specifically trying to outline issues or concerns with the plan, it would be a request that we are allowed to implement our own plan. So being able to change anything before phase 1 ultimately expires, I think, is highly unlikely. I think we're asking that we be able to take control of this at a local level, because I don't want to have to live through her phase 2 and phase 3.
I would agree with that, but I think these particular areas are the problematic ones, and we're actually going to drive several. I had a conversation with a couple of people. We're going to drive some people out of business. I mean, not us, the county commission. And by the way, the county commission this would not have been part of our order, and people should understand that. The governor's order is going to not allow these businesses to open, and we're going to have some people actually going out of business if we don't. And I'm really, it's kind of upsetting. It's upsetting to a lot of people, but the only thing we can do is use our power to request, So however the letter, I guess I'd be willing to let Mark kind of draft it up for us for next week, and all the commissioners kind of give their input if that's what everybody thinks we should do, and then look at it.
So that'd be a consensus?
This is Commissioner Cos. I would agree to that.
Okay. So is this consensus that either county council or county administrator craft a letter to be sent?
I think it should be your administrator,
Well, we got to make sure it passes legal muster.
Mr. Chairman, Commissioner Shimke, if I could, is the intent of the letter to request that the control over who qualifies as a business for the opening phase 1 be devolved from the governor to local authority?
I think what it would be is that the local authority be local authority. We have the determination of all of our orders, and we don't need a phase 1, 2, or 3 from the state.
Sounds fair. Okay.
Does that work for everybody else?
Yeah. Is there anything, any other questions or concerns anybody has before we adjourn?
I wanted to bring up one item.
Okay.
We are, because of the response to the pandemic and because we're trying to get some personal protective equipment for staff, there are going to be instances where we are purchasing items that were not typically in our budget. We have money in the budget for expenditures not specific to masks or gloves or something like that. So I just want to let the board know that there are expenditures that are going through. They're probably considered emergency purchases, but I wanted just to give you a heads up. Like masks, I'm going to be buying additional masks for staff. It's going to be in excess of $10,000, so I just wanted to let you all know that in advance. So if you see that coming through, you won't be surprised.
That's part of the emergency declaration.
So just
and would things like that be reimbursable from FEMA?
I'm sorry?
Would something like that be reimbursable from FEMA?
That is the hopes.
Okay.
Obviously, that's, again, why we put all the steps in doing the local emergency. So as we go through this process and we track all of the expenses and all the financial that's associated to COVID-19, when those funds are available, then we submit all that in for reimbursement, similar to a tornado or similar to when we have the floods and such. So again, we're tracking all of that from day one. We've been tracking all of that. That's all part of the incident management team out there as well. Mark's tracking things for obviously the county side, but again, us for the actual response side. If you go out there from day one, we've been tracking all for everything from overtime to materials to everything that we've expended in hopes that will be reimbursed at the end.
Okay.
And who ultimately makes that decision?
I'm sorry?
Who ultimately makes that decision? I'm just curious.
Who often?
On FEMA reimbursement?
Yeah. There was some funding already that has come through on the public health emergency preparedness side, a very small amount. We received about $20,000. Again, in the overtime already, $20,000 is getting very close to being used up in that category, as well as some PPE and things of that nature. But our hopes is in the long run, and Mark has alluded to, there's funding that has been identified for COVID-19 to specific states and all states, and there's a certain dollar figure, and I know you talked and spoke on it, so.
Yeah, hopefully that's the CARES Act funding that we're talking about that the state should be getting and passing on to the counties.
There you go with the should be, not shall be.
This is Commissioner Steben. Mark, is the Board of County Commissioners meeting next week going to be open to a social distance group of people, or are we still going to be closed?
You mean for the public to
Meeting.
attend the
Yeah.
meeting? Yeah, no, my intention is that they would, a limited number of people would be able to attend in person if they chose, but obviously we would recommend against it unless it was a necessity.
Okay. And also, Jamie, I just want you to know, we give you some hard questions here, but and you've got a hard job, but we all think you're doing a great job, and we appreciate what you're doing. And I hope you don't ever feel that when we're asking these hard questions that we don't support you. We really do.
That's on a motion, but I would second that.
Yeah. We
This
don't
is
vote.
Commissioner Cobb. I just have one more thing.
All right.
And it's more on a semi-personal level, but I just think that because right now as we're meeting, Terry Lewis's family is burying him, and he lost his battle to the COVID virus, about a week ago. And so I think that we really need to recognize that we've lost 5 people to the COVID virus in our county, and although people say that's not very many, it's devastating to the family members of those people.
I agree. Okay. And Commissioner Cos, you'll do that phone conference this afternoon at 3:30?
Yes, sir, I will.
All right, thank you.
Thanks, Vicki.
Anything else before we adjourn?
I just want to reiterate what Commissioner Shemke said and kind of summarize, even though it's hard to summarize because there's a lot of unique things going on. But basically, for the listeners, so the county drafted a set of rules that were less stringent than the state's set of guidelines, but we're forced to use the state set of guidelines. So according to the state set of guidelines, a lot of people are asking, some of the main questions are, as far as restaurants opening, Monday, the state set of guidelines say that the dining areas in restaurants can't open. There's some limits, 10 people per table, and the tables all have to be 6 feet apart. They're also Monday opening up the daycares. And in 2 weeks, on May 19th, pretty much the rest of the businesses are open, according to the state's plans. So the letter that we're drafting is to ask the state, can we go to our own set of guidelines? Whether or not we can get that accomplished in 2 weeks, I highly doubt, but at least that's what we're asking for.
But you don't know if it's going to change at the state level on May 18th.
Depending on what happens.
Could be an extension
yeah.
at that time, too.
Yeah, if things go downhill and a lot more people get sick and it's inundating our sources, then the 19th might not happen. So that would play on the letter that we're sending to use our local guidelines.
Okay.
That's all I had.
If there's nothing else, then I'll entertain a motion to adjourn.
So moved.
Second.
Voting.
Aye.
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 That's carried. Thanks, Jamie, for taking the time to come in here again today.